ladies and gentlemen. We are Team 11, Shantou University. I'm Susan, and here are my teammates, Horace, Jane, and Pali. Well, a few days ago, we met a really interesting guy in Canada, and I'd love to introduce him to you, Dr. McKesson. Well, actually, Dr. McKesson comes from here, Montreal, Quebec, in 1905, and he's a respected doctor who is really good at global supply chain and healthcare service, and he's also a sincere and responsible person who always carries the mission: better health, better care, and better value. And actually, Dr. McKesson is now facing a problem that the patient, clinic, and healthcare system are having problem balancing the relationship with three stakeholders: the government, who is actually paying for the healthcare service, the hospital, who is deciding, and the patients, who is using it. And today we are definitely going to help Dr. McKesson and his patients. After our diagnosis, we will provide 3 key treatments for in using the HAS method, and we are also going to accompany Dr. McKesson with his self-improvement. Now I will pass to my partner Horace for the diagnosis.
After making an appointment, now let's diagnose disease for Canada healthcare system. Recently, Canada healthcare system suffered from the increasing need for healthcare. If we date back to 1956, we can see the population rose rapidly, but now it has already changed. The speed of the public growth is slowing down, and the aging boomer generation is become more and more, and they require more healthcare. As we expect in the future, the speed of this population growth, it will continue to decrease, which means that this group will become larger and larger, indicates a huge potential in the future. On the contrast, there is a lot of ineffective use of resources. For instance, nursing staff spend nearly 50% to 70% of their time dealing with the medical-related stuff instead of nursing. This, as we know, is including some important and skilled medical staff, including staff in operation room and ICU. On the other hand, lots of hospital space was occupied by the expiry drugs and the needless stuff, which we can totally remove them and save this space to do other things. In terms of the government budget, with nearly 70% of the healthcare expenditure was spent in the public sectors, and with healthcare budget at nearly and already 40 to 50% of total provincial budget, the government could not offer this huge budget for aging boomer generation. Therefore, it will prevent the development of Dr. McKesson. Last but not least, shortage of the qualified medical staff result in ineffective treatment, and it result in errors in the dosage and dosage of medication. In order to solve this problem, in order to cure our patient, we suggest that Dr. Mason can insist on developing a hospital automation solution. On the one hand, because Dr. McKesson has already served 200 to 300 hospitals, and on the other hand, the technology used and promoted by the Dr. McKesson is mature and is growing rapidly, which will help us to develop ourselves better. As we can see from this growth, the position of this industry is already in growth phase, which shows a great potential in the future. We believe that Dr. McKesson can focus on HAS by reduce human intervention, increase efficiency, maximize hospital space, and avoid medical errors to make them better. Now, let's give them more detailed treatment.
So what is HAS development situation in Canada now? First, let's look at these pictures. We can see that most
Canadian populations are located in Ontario's Quebec, British Columbia, and Alberta, which accounts for 14% of Canadians' populations, 25% and 10% each. So today's our analysis will mainly focus on these four markets. In Quebec, actually it works very well because we promoted provinces, and in Ontario it also works well. But as for the West, it is a very potential market. So the issues and opportunities in this four market are also very different. In Ontario and Quebec, although it can enjoy a high level of medical services, some small cities like Kingston that they can't enjoy the same level of medical services at these places. And as for the British Columbia and Alberta, since the number of GP is really small at these places, so the patient have to wait for a long time to see a doctor. So because it's quite different in this four market, we have our three different treatments. The first one is our promotion plan for HAS in the whole country. And the second one is develop our HAS machines, make it become your personal reminders and works well in home health cares and long-term cares. And the third one is a totally new innovations, by McKesson. That is a new kind of GP. And now I will recommend you the first treatment, the promotion plan. Just that I have mentioned about that some small cities like Kingston, Windsor, that the medical staff there are really limited. Also, that the efficiency there really need to improve. So we recommend that Dr. McKesson can put the emphasis on these small cities and promote some small machines like Pacman and the anesthesia RX in this kind of cities. Because this kind of cities hospitals are really small, and this kind of machines were more flexible there, and the government also can more easy to afford it. And as for our implementations plan, we recommend that in the next 5 years, Dr. McKesson can go on to promote the big robot in the big cities in Ontario and Quebec. But from 2015 to 2017, we can promote some small machines in small cities like Kingston and Windsor. And from 2018 and 2019, we can go to enter the British Columbia market and Alberta markets. So except the low efficiency in hospitals, the clinical disease is also a big challenge that Canada faces now. Just as my partner Horace has mentioned about, that Canada now are facing aging boomers. More and more people are getting older, and they really need cares at home for a long time. Also, from these tables, we can also see that the number of patients with clinical disease like diabetes are rising from 2009 to 2013. Also, the beds in the hospitals are really not enough for the demands. So, in conclusions, nowadays providing home health care is more and more necessary in Canada. To solve these problems, we have our second treatments. That is add more new functions to the Dr. McKesson's packaging machine, the Pacman and the Pacvisions. As you can see that there is a QR code on the packagings. If you have this kind of functions, when you scan the code on the packagings, it will help you to set an alarm on the phone and remind you to take the medicine at the exactly right times. We know that nowadays, Dr. McKesson's packagings will have some notes to remind you when to eat the medicines. But for some person, like me, even will forget where I put my medicines. If I don't know where is the pills, I don't see it, how can I remember to take the medicines? So if you have these kind of functions, when you get a lot of medicine from the hospital, just scan one pill of them. And at the following day, you just have to follow the mobile phone and you don't need to remember anything. And about our second function is that it will remind you about the taboos and notice for your units. Actually, when we take some medicines, if we can sleep at regular times, we can have proper sports and eat proper food, it will help a lot for our units. So this function will warmly remind you on the cell phone by pushing the notifications. And let's welcome my partner. Students explain about the
I'm going to walk you through our third treatment. And through the process, we are helping the patient. We find out there is one big problem in Canadians general practitioners. From this map, we can see actually the national average proportions of the residents in Canada without a general practitioner is very high. It's about 15%. And within the 13 provinces in Canada, actually there are 6 provinces rate is higher than the average. And if we take a look at Quebec, actually the rate is quite high. There are about 25% of the residents in Quebec don't have a general practitioner. So actually our treatment 3 is meant to solve this problem in Canada. Well, now let me present to you our McKesson. Well, McKesson is your private health assistant and actually is a healthcare artificial intelligence, which is a robot you can put in clinics and hospitals. Well, it will look like a GP machine, and hopefully it will look this cute like a Baymax. And it's also very multifunctional. It will provide the blood pressure measurement, blood test analysis, heart rate tests for its patients, and also it can analyze minor health problems such as cold, fever, scratch, insomnia, and give patients advices and prescriptions. And in addition, this McKesson can also save patients' profiles and remind the patients of the regular checking. And if the McKesson decided that your illness is out of its control, he will send your profile to a specialist physician and make a reservation for you. And actually, compared to the human general practitioners, one advantage for McKesson is that it will provide multi-language services, which is very necessary in Canada. Because right now, Canada is a very diverse country. There are some residents in Canada, they want someone who can speak their native languages when they are looking for family doctors. And this problem is very flexible for McKesson to deal with. And next, I will walk you through the process to consult a McKesson, which is very simple. Well, let's suppose that you wake up this morning and didn't feel well. So what you have to do is only open up your computer and then go to the McKesson system, make a reservation. And then you can go to the clinics nearby in the afternoon and start your McKesson consulting. Let's suppose that you are catching a cold. So your own McKesson will provide you a prescription that you can use to get drugs from the nearby pharmacy. And if your illness, McKesson decided is out of his control, he will send your profile to a specialist physician and make a reservation for you so you can take specific tests in your specialist physicians there. And since McKesson is a newly invented high technology, there are some risks. But those risks can be minimized. To be honest, we cannot deny that McKesson cannot have some functions like the human general practitioners because it's a robot. It cannot provide human cares. But we can do something to minimize the effect. For example, like the humanization design. Well, many people cannot say no to a super cute robot, right? And also, our intention for McKesson is use it as a help for the general practitioners in clinics and hospitals, but not a replacement. And we are definitely recommend Dr. McKesson to do some experimental marketing before the promotion and also keep the customer relationship management. So, in conclusion, this high technology will greatly help solve the general practitioner problems in Canada now. People who don't have general practitioners in the past can now afford and have access to a basement care, and also hospitals and clinics. Efficiency will be greatly increased. There will be less waiting time in the hospital in the future. In terms of the cost and payback of this high technology, well, to be honest, the cost in the first few years will be high because of the research and development, but the income in the next few years will increase rapidly, and actually the expected payback period for these investments is expected to be only 3 years. The ROI will reach 7.9%, and the NPV will reach 67 million Canadian dollars.
After giving the treatment, Dr. McKesson is wondering what he can do to improve himself. Firstly, he thinks of his exclusive assistant, that is Nurse Agent. They have been cooperating for a very long time, and Nurse Agent is a best nurse. She has been a leader in pharmacy automation for more than 25 years. And now, Nurse Agent is adopted by Francisco Partners, whose emphasis is on transformation capital, while Dr. Maxon's always emphasize on quality, so it may exist some friction and challenges between them. And a nurse agent is an obedient child. She also submits to his step-parents. So Dr. McKesson is wondering whether he should keep up this partnership under the different value of himself and his partner's step-parents. Then he found that if he don't want to maintain this partnership, he will need to find a new partner, and it is of high risk, and it takes time for him to pick up a good and suitable partner. And now, Nurse Agent does very well in this field, and it's very hard to find one to replace it in technology and quality. And next, it will lose loyalty of the market because Nurse Agent is very is known as its technology and quality. So it will lose part of market if Dr. McKesson chooses to give up this partnership. And what will it be if Dr. McKesson chooses to maintain the partnership? Firstly, it can still enjoy the exclusive assistance of Nurse Agent. Because secondly, it can ensure its business. Now, Dr. McKesson has another assistant, JV Media, and there is a complementary relationship between JV Media and Agent, so it's better for them to work together. And thirdly, the check-stick cooperation between McKesson and Agent can really do help to their business. So, because under the different value of Dr. McKesson and Francisco Partners, there exists some friction and challenges, but we suggest Dr. McKesson to improve its bargaining power and keep up the relationship with Agent. So in conclusion, during the whole diagnosis, there were 4 things that Dr. McKesson can do to help the patient, Canadian healthcare system to improve himself. They are carry out a promotion plan, develop your personal reminder and event basement, and also keep up the relationship with Nurse Agent. And also in this way, Dr. McKesson can do better in drugs distribution, medical supplies, and healthcare information technology. This is all our diagnosis. Thanks for attention. Now the floor is opening for Q&A section.
With respect to you have a market penetration strategy where you identify the Western provinces as an opportunity. You also talk about how we're present in Quebec and Ontario. And then you talk specifically about targeting small cities.
Yes.
With specific products. Can you just elaborate on your rationale as why you selected those cities?
Okay, here is our implementation plan. And see why we choose this 4 city, because this 4 city is famous for its travel tourism, and also the economic development. I think that is well enough. And so we think that the people there's really needs to improve. They can offer this kind of expense, and also that the medical resources actually is really imbalanced in the province like Ontario and Quebec. So we choose these 4 cities as our major market to enter, and we will put the emphasis on small machines in these cities. Thank you.
Just a
point of clarification for the McKesson, the artificial intelligence. Would it be McKesson developing the technology, or would they be distributing an existing technology from someone else? Just to clarify.
Yeah. Actually, I recommend that McKesson will start McKesson Canada will start a collaboration with U.S. McKesson in R&D department and invent this newly product, and then start a trial production, and maybe the Quebec can be the first target market.
Yeah, have you scoped the investment approximately that would be required to develop that solution, the Baymaxon? Financially, how much money do you evaluate that we should put in this project?
Well, actually, we expected the total cost and expenses of this newly invented productions in the next 5 years. But since it's a new product and the R&D department haven't started its research, so it's just an expected number, and those numbers are based on the annual report from the McKesson Canada. Yeah.
Okay, thanks.
In the implementation slide that you had, is the objective to enter into Alberta and BC? Because we say that there are opportunities, but is our plan to go later, or is it not?
Yes, we decided to.
Yeah.
So, yes, we decided to enter this market maybe later than some other small cities in Quebec and Ontario.
Okay, so is it, okay.
Because actually in some big cities, the market for McKesson is a mature market, and we see the demand and the opportunities in those small cities. So we are going to enter this market step by step. Yeah.
Just a quick question about a point you brought up earlier in the presentation. I think it's on slide number 6. There's reference to a high-speed staple technology as part of the automation solution, I think. Can you elaborate on that? What that's all about?
I just mentioned that this the industry automation use and promote is pretty new, and the technology they use is at a high speed because it's a new technology, and also the partner McKesson cooperate with Asian cooperation have the stable technology which can help us to develop this kind of machine stably. So we think on the other hand, there is less competitor in this field. So we think that it is very stable and it will grow rapidly in the future.
So is that new technology part of the financials that you've presented and part of the growth prospect that you presented? I mean, are we talking about a high-speed stapling technology for suturing?
Yeah.
I don't think so.
No?
No.
No?
I think
It's
Just like
package,
staple,
yeah.
as in the adjective rather than
Oh,
the
a
noun.
staple, like a
It's
staple?
like yeah,
Okay.
yeah.
Okay,
Thank you.
fine, thank you.
That's it for me.
Thank you.
Thank you.
Thank you.
Thank you.